Do this. Okay. So, what is your main concern? That you have facial asymmetry?
Yes.
That's right. Okay, open your mouth, please. Open nicely. Bite. And open. Bite. Okay. Bite. Yes. Open. Say ha. Ha. Okay, bite. Open. Bite. Open. Any pain when you do this? Just one sound.
Yes.
But no दर्द कुछ नहीं. Okay, bite. Okay, leave relax. अभी तक क्या क्या ट्रीटमेंट किया अभी आपने?
Just aligners. I was on aligners.
That's
for
all.
5 months.
कुछ भी ट्रीटमेंट नहीं कराई आपने. Okay. So see, आपको प्रॉब्लम लोअर जॉ में है, जिसका मेन रीज़न है ग्रोथ. मतलब जो सेकेंड ग्रोथ स्पर्ट होता है ऐसे लाइक 15 ईयर्स 14 ईयर्स गर्ल्स में, उनमें इनका लोअर जॉ ग्रो नहीं हुआ एक साइड में, इसके वजह से ये डिफॉर्मिटी हुआ है. सो अगर आप इनके यंगर फोटोज़ देखते हैं लाइक 10 ईयर्स 9 ईयर्स, कुछ नहीं दिखेगा, फेस बराबर दिखेगा जनरली. उसके बाद से ये स्टार्ट होता है बिकॉज ग्रोथ स्पर्ट में ये फिट नहीं होगा. अपर जॉ अच्छी तरह से ग्रो हुआ है, लोअर जॉ ग्रो नहीं हुआ है. ये है इनका रीज़न ऐसा होने का. अब ऐसा करो, नहीं पीछे रख के करो. ओके राइट. अब देखो इनका बाइट काफ़ी अच्छा है, मतलब अच्छी तरह से ये चबा पा रही हैं, मुंह अच्छी तरह से खोल रही हैं, फंक्शनैलिटी में कोई प्रॉब्लम नहीं है. तो विदाउट टचिंग द बाइट सिर्फ एस्थेटिकली हम करेक्ट कर सकते हैं इसको, लोअर जॉ को. हाँ, अपर जॉ को करने की जरूरत.
When I smile, something which is quite protruding.
Yes, a little bit.
Yeah, so I want that to be like inside.
You want to take the upper jaw inside? But no, it's not a good idea to do that aesthetically because it's going to make you look older.
Okay.
When you take your upper jaw inside, it's just in the right position now. If you take it inside, the support of the soft tissues will be less and start drooping. The fullness will go away. You
So
know
once
that.
this comes out,
I think it'll be good. It will be fine. See, the thing is, you could have done braces after that, but then anyway, you've done the braces. So that's why probably we can't alter the position of the teeth much now. But let's fix the jaw to start with. We can improve the entire. I'll have to work not just on the chin for you. We'll have to work on the back also, so that bite. Yeah, relax. So that we move it. We have to move the entire jaw, increase the length here, increase the proportion, projection, काफ़ी कुछ करना है. So let us do the jaw procedure on the lower jaw fully. Then after that, if you think you still need some braces, you can consider braces on the upper jaw later on. I think that might be a better solution.
What for?
For your protrusion, you're saying, na? No surgery for upper jaw.
Okay.
I don't think it's needed because if you do it, it's going to make your face look. हाँ, थोड़ा मतलब ये यंग लुक चले जाएगा थोड़ा, तो नहीं करना चाहिए. I don't think it's needed. फर्क पड़ेगा, फेस की सिमेट्री आ जाएगी. देखो मैडम 100% शायद ना हो पाएगा, 90% 95% हो सकता है इनके, बिकॉज कॉम्प्लेक्स डिफॉर्मिटी है. हो जाता है काफ़ी पेशेंट्स का 100%, बट आपको मेंटली 90% के लिए प्रिपेयर होना है. क्योंकि समटाइम्स बिकॉज देखो it's a pretty difficult deformity on the scan also. No, I'll show you the scan also. So that's why I'm saying first only. And I don't want to do anything with your bite. मतलब जो जान जैसे बैट हो रहा है उसको ऐसे ही छोड़ते हैं बिकॉज दैट्स योर फंक्शनैलिटी. उसको वी डोंट हैव टू ऑल्टर दैट. यू सी हाउ मच ऑफ डिफरेंस इज देयर इन योर शेप इटसेल्फ. यू कैन सी द शेप ऑफ द लोअर जॉ. यू हैव एन इम्पैक्टेड टूथ ऑल्सो इनसाइड व्हिच इज नॉट अ गुड थिंग. So you see it's gone fully towards one side. Can you see the shift?
Yes.
So I'll be working from this side, this point exactly, the ramus, to this point.
Okay.
Only then we can give you 90% something. If I do only your chin, you won't get a very good result. You'll only be able to get this midline, you get hollowing here. So we'll have to do a different type of orthomorphic procedure to correct this kind of deformity. Okay. So when we do this, well, a few things that you'll have to understand is that it takes a few weeks for it to heal, because we're going to basically split the jaw, cut it and move it. So 4 to 5 weeks rest, 4 weeks rest at least. घर में सर, हाँ यहाँ पे 1 हफ्ता, उसके बाद 3 हफ्ता.
अगर सर्जरी होती है तो 1 week need in the hospital.
5 days in the hospital at least. उसके बाद हमारे शहर में और 2-3 दिन, फिर 7-8 दिन के बाद आप जा सकते हैं. अगर हमने आपको ओके कर दिया, उसके बाद और 3 हफ्ता मतलब काइंड ऑफ रेस्ट. रोटी खाने के लिए 2-3 हफ्ता लगेगा, जल्दी नहीं खा पाएंगी. चावल 10 दिन, 8 दिन, 1 हफ्ते के बाद. लिक्विड डाइट होगा फर्स्ट 3-4 दिन, फिर सॉफ्ट सॉलिड डाइट होगा. हाँ ये सब है, मिल जाएगा, बट आपको बता रहा है तब तो लिक्विड ही होगा. जब वो सॉफ्ट सॉलिड डाइट में मूव करेंगे तभी आपको हम डिस्चार्ज करेंगे. और ऑल्सो इनिशियली थोड़ा ब्लीडिंग हो सकता है, बिकॉज यू नो पूरा जॉ को ओपन करके कर रहे हैं.
And how much of height can I gain? Like I wanted to have like more long.
See, we can now the ideal requirement may be even 25 millimeters. That's a lot, ideally, to make your face very proportional. But we can't do that much in one go. If I have to do so much, then we have to take bone graft, take another procedure, हड्डी निकालना पड़ेगा पाँव से. So it's not recommended for you. तो क्या, and also the skin has to stretch. Okay, so what we do is I'll move by about 15 millimeters. 15 millimeter इतना होता है. इतना चेंज आएगा आपके फेस में, मतलब बहुत. बट यू माइट स्टिल फील 6 मंथ के बाद और थोड़ा आगे अच्छा आता तो अच्छा लगता, ये हो सकता है.
That would be horizontal.
एवरीथिंग वर्टिकल भी होगा ना, आपका वर्टिकल भी शॉर्ट है, पीछे है. Come here. I'll show you. It's not just horizontal vertical for you. See, when we're talking about horizontal vertical, when there is no symmetry, in your case, this point is here, this will come here. So it will rotate and come.
Okay.
Then this is all hollow. This will get full. This will get full like this. Then this length is short. It will come down. So the future thing will come something like this.
So like, can you explain?
So this also will increase till about this much, and this will increase by 14 mm.
Anyways, I just want this to be like more.
Yeah, because we'll match with that.
Yeah.
That's the goal. But we have limitations in moving the existing bone to a particular limit of 14-15 mm.
Okay.
That much I do.
Yeah.
That itself is like living on the edge. It's like stretching it too much. So we can't do more than that. And your deformity is much more than that actually. So, but this is a safer thing. कुछ नहीं कर रहे. See, it's like आपका फ़ोन था पहले, स्लाइड होता था, बंद होता था. अब अगर आप ही सोच लो, अगर फ़ोन का लंबाई इतना है तो कितना स्लाइड हो पाएगा? इतना हो पाएगा शायद, इतना नहीं हो पाएगा ना. फिर तो फ़ोन का लेंथ से ज़्यादा नहीं हो पाएगा. ये सिमिलर सिचुएशन है. अगर हड्डी का लेंथ इतना है तो उतना ही स्लाइड हो पाएगा वो. ये सिमिलर टू स्लाइडिंग रोटेशन प्रोसीजर है.
चेंज पता लगेगा हमारे को देखने से.
बहुत. अरे ये क्या क्वेश्चन पूछ लिया आपने?
For that surgery.
ह्यूज डिफरेंट. 15 मिलीमीटर मतलब इतना है. और सिर्फ यहाँ पे नहीं सर, इनका पूरा फेस में आपको चेंज पता लगेगा. यहाँ पे कितना कम है, यहाँ पे पूरा
ये कम हो जाएगा, ये वाला
ज़्यादा होगा. ये
वाला बड़ा है.
ये सब सॉफ्ट टिश्यू नहीं रहेगा. ये वो नहीं, ये फैक्ट नहीं है. ये बिकॉज इनका जॉ छोटा है, आपको लग रहा है, वो सब अच्छा हो जाएगा ना.
कुछ कॉम्प्लिकेशंस बाद में भी आ सकती है क्या आफ्टर सर्जरी?
तो टेम्पररी कॉम्प्लिकेशन जो हो सकती है जब हम इतने लंबे मूवमेंट्स कर रहे हैं, एक तो है टेम्पररी नमनेस, पैरासिसिया बोलते हैं उसको. बिकॉज देखो ये लिमिटेशन जो हम बता रहे हैं, बिकॉज नर्व के बीच में कट करना पड़ता है, दांत के बीच में कट करना पड़ता है. सो ओनली दैट मच ऑफ लीवे वी हैव विदाउट डैमेजिंग एनी ऑफ द एनाटॉमिकल वाइटल स्ट्रक्चर्स एंड येट अचीविंग व्हाट वी वांट टू डू. तो सम पेशेंट्स ना फॉर 2-3 मंथ्स दे कैन हैव नमनेस ऑन द लिप और द चिन. इतना टेम्पररी, बाद में निकल जाएगा. और खाना का तो मैंने बता दिया आपको ऑलरेडी. लाइक यू कांट च्यू अ लॉट फॉर 4 weeks. उसके बाद आफ्टर दैट it will be normal like this.
After 1 week,
After 1 month.
After 1 week, you can take rice also.
Maybe 10 days.
10 days.
हाँ बताएंगे. सॉफ्ट डाइट हो जाएगा 1 हफ्ते के बाद.
उसके बाद हमें फिर Baby power type products.
Like I've got a reference.
You've got a sorry?
I've got a reference.
Huh.
Something that you did only.
Yeah.
Like this is like.
Baba, no. See, this is not a asymmetry case. We're doing just for cosmetics.
Alright. Okay.
So we can give her that kind of a look. There's a girl here right now. I've done more for her also. So your case will be your end result will be better than that.
Like
This is also not asymmetrical, but your result will be better than this.
okay.
Yeah, but I've done a nose also.
Yeah. In this case, matlab I just want more height to the.
I understood that. I understood. We'll do that for you. We'll do the maximum. There are many you can see on my. There are some asymmetry also. Yeah. So
The
this
height bit.
this we did a little too much for her.
Okay.
You wanted that much? I think I did bone grafting also for her.
That'll be a lot.
That'll be extra procedure.
Yeah.
No need. For your face, it'll suit better. I think that what I'm.
हमारी bones allow कर रही है ना उसको इस time.
And it's gonna be flat, right? Like it's gonna be the smile is gonna.
So see what can happen is now you see this is not nice.
Yeah.
This is nicer, but in your case, this groove might be a little bit more than this.
Okay.
This is too less, and this is too correct.
Yeah.
It's going to be a little bit exaggerated because of the fact that we're moving the jaw forward and also rotating it.
Okay.
All these procedures, see, your problem is not any of the things that you've shown me. What you're showing me is a classical condition of a small chin or retruded chin. That is not your diagnosis.
Okay.
Your diagnosis is asymmetrical lower third. Problem is not only here. It's here, it's here. It's very clear. I'm showing the scan. Everywhere you see, I show you. You can understand anybody who has, like, you don't need any. I show you in this. You see. See the difference. So see this height. See this. Great. It's gonna take a while now.
Love it.
What are you doing now?
I'm a graphic designer.
Okay.
She can regularly work.
Sure. Off online you can work even the next day.
Okay.
Any precautions later on?
Nothing later on. I told you already. That's all.
So like, can we somewhat expect this much of height after?
Not so much.
Not so much.
This is too much.
But
But it suits her because check the nose, check her forehead. Your face is not like that, right?
Okay.
She's got this much big forehead and a big nose. For your face, you give that, it look too bad.
Alright.
So this is your height. This is your height. I can't give you a chin that's like that much. It's not going to suit anyways. So it's proportion to your face we have to do. So for her, the thing is way too much. So it suits.
Alright.
We're not going to give you that kind of a lower third.
This much will be.
14 mm. Because see, that will be the height. That we'll check. But it's not going to be so much like what you're showing me.
Probably 15 mm would do like long.
14 mm. 14, 15 mm we'll do max.
15. Okay.
And but we'll get fullness here also. We'll
Yeah.
get some fullness here. We'll get some
And
length
the
on this
buckle
side.
That would go inside.
Only if you remove it will go.
Yeah.
चाहिए buccal fat नहीं चाहिए. I don't think you need to do.
Only suggest.
The only other procedure, take your specs off please for me. The only other thing that can benefit you is little tight, reducing this width if you want. If you don't want, leave it. I don't suggest buccal fat. It's not needed.
What about the chiseled aspect?
You will get it, I think, with this surgery.
Chiseled
Without
aspect
buccal
of
fat.
the
Yeah,
cheekbone.
yeah.
Okay.
You should get it.
Okay.
Buccal pad fat is not a big procedure. It only makes 3 millimeters of difference. If you want, we can do it. It's not like it doesn't have any great implication. Subtle changes will be there. So what it generally does is, यहाँ पे जो आपका cheek ऐसा आ रहा है ना, it will give you a depression there.
Yeah, so that's it.
That gives a little bit more.
Chiseled aspect.
If you want, I can do that. It's not a.
So probably we can also.
I can do that. No problem.
Rest, anything else if you suggest?
The side of the nose if you want, if it's too broad. Otherwise, don't do anything else. Then leave it.
And when I smile, tubing, so will that get corrected?
That I said, right? We can't take the upper jaw back. We shouldn't.
Okay.
So once you move this and then again you can put braces. They can move it back by 1 or 2 mm. But not a surgery for the upper jaw. You shouldn't take it back. No. तो वो यूज़ करिए, वो यूज़ you can continue with that.
Upper side or both side?
अपर लोअर की तो कोई ज़रूरत नहीं है. समटाइम्स क्या होता है ना सर, जब लोअर टीथ अंदर आते हैं तभी अंदर भी ऊपर का भी अंदर ले जा सकते हैं. इफ दैट इज द केस देन यू कैन डू द लोअर ऑल्सो. दैट यू कैन मेक अ कॉल लेटर ऑन. आई डोंट थिंक यू नीड टू डू सर्जरी फॉर दैट. So when would you want me to do all of this? Tomorrow? Or you're going to come later on? 28th is what day? Saturday. Unfortunately, I may not be available for surgeries. So it has to be either tomorrow or Monday. Shall we do it on Monday then?
Maybe tomorrow.
Tomorrow is
Is fine.
Tomorrow we will.
Tomorrow is fine.
Yeah, I'll just check with tomorrow if I'm no more
Because we
appointments.
have to already.
Okay, when are you plan your ticket back?
6th June.
6th.
6th, yes.
Okay, we'll try tomorrow. I'll try. Okay, let's get the blood test. Rejo ke saath bhejo. So you're going to talk to my executive because see, I don't know what exactly we have told you during the WhatsApp consultation because this is a twisted deformity. Sometimes we would have said only genioplasty. We wouldn't have said anything about there.
You said Bimax and bite correction.
Okay, so then it's going to be similar costing because that's like a bigger procedure we've suggested also. Bimax is not what we're doing. We're doing one jaw more surgery but not Bimax. We're not touching the upper jaw. We shouldn't touch your upper jaw. So you can find out from him the costing, get the blood test done. If everything is normal and okay, we'll plan tomorrow.
Morning.
Morning.
And for that, do I need to have any fasting?
Yeah, we'll tell you that.
Okay.
Once we work you up and then we'll give you the timing for tomorrow and then we'll tell you the fasting time.
Alright.
ठीक है? Right. इनका photos भी ले लेना. We'll be doing a variant of a procedure that's called orthomorphic. Ortho refers to bone, morphic refers to the shape. This is a variant of the orthognathic surgery. Orthognathic is movement of the jaws. Gnathia is jaw, okay? So this is the technique wherein what we'll do basically, so since we need fullness here and since you need length there, we're going to make an arc kind of an osteotomy and switch the, like move the lower part around like this. So when I rotate it, this part will come forward, this will come outside and you'll get more fullness on this side. So that's the plan for you, and because the chin has gone to this side, so we're probably going to move the chin as well, and everything will happen with this osteotomy.
The asymmetry would get
Yes,
corrected.
like I said, 90% at least. Yeah, so you can keep it bitten. So when you bite and keep, the asymmetry and the deficiency is more obvious. When you open your mouth, it looks less obvious, obviously, because the jaw then comes a little forward, okay? Right. So yeah, so we already mentioned about your diet. You'll have to be on some soft solid diets, okay, for the first few days, and then after that semi-solids, and then eventually it'll take a while before you get down to your normal proper diet. All right, and the anesthesia is going to be given through your nose. So sometimes the nose also can get a little stuffy, and the throat also can get a little itchy or can get a little sore. I mean, it's going to settle down very quickly. After the anesthesia, once you come out, sometimes patients do have pain. So if you have pain, you just call and let us know, because then we can adjust the dosage of these drugs that we're giving, the pain meds, so you're not going to have pain. Just remember that. You don't have to wait for 24 hours and say, doctor, I had pain yesterday. Some patients do say this because they think they should not tell us, but you should tell us, especially initial hours after anesthesia. Okay? Anesthesia is going to be super smooth. He's just going to keep a mask in your face and he's just going to go off. and then we'll come in and do everything. We're thinking it's going to take us about 3 hours, 2.5 hours, in that range. All right? You're okay, right?
Yes.
See you. Right. So we've just completed with this facial asymmetry correction. We're going to show you how she looked before on the side view. You can see that it's a lot of improvement. Okay, now come on to the front view. So this was a combination of orthognathic and genioplasty surgery. So you can see the improvement in the, you can see the asymmetry, how the right side of the face was totally gone inside. The chin was short. So we've augmented that. Okay, let me see. Open, Baba. Okay. Yeah. Suction. हो गया 1 मिनट. Suction. You can bite. அது என்னது 40 அது வேண்டாம், அந்த 40 வைக்கல் வேணும், அதோட இது போடலாம். What is she getting? Piptas? How many days up?
It's 3 days up now.
You can put on Piptas. So wear gloves, get suction. That's all we need. Open. So there's a small collection here, okay? And there's a small opening. So I'm just going to put one stitch there so that it won't hurt you. I've put a gel already. This gel, see this? See this? It's a local anesthesia gel, okay? So it will numb the area, but you'll feel a small, like a small prick you'll feel. Nothing more, but don't move. Just take a second, okay? Open. Don't worry, just relax. Okay. Right? Any collection you had after that?
Very little.
Very little.
Like
It can थोड़ी देर अभी भी हो सकता है मैडम, स्वेलिंग है ना और कलेक्शन, बट इवेंचुअली वो निकल जाएगा. I'll just sorry. All right. Okay, show me. See how she looks. Symmetric ना? मैंने आपको 90% बताया, शायद उससे ज़्यादा ही है. कैसा लग रहा है? Almost. मतलब स्ट्रेट। अभी स्कैन भी निकालेंगे और आपको प्लेट स्क्रू जो अंदर है वो दिखाएंगे, कहाँ पे प्लेट स्क्रूज हैं, कहाँ पे कट हुआ है, क्यों आपको मालूम होना है। ओके, आई एम गोइंग टू डू दैट फॉर यू, गोइंग टू टेक अ स्कैन, शो यू। ओके, सो यू कैन सी द tilt with this. We give her a mirror, right? Let her have a look. देखो ना आप, अब देखो, ऐसे देखो, ये व्यू नहीं, you have to see. I want you to see the improvement in the jaw line. Okay? क्या है ये? दो ही है पिक्चर्स, बाकी नहीं आ रहे। Swelling everywhere, swelling is there, right? It will come down.
Wi-Fi connection promotion.
Five other.
Wi-Fi connection is very low.
This view is nice. I'm going to wait for the other pictures. Get the pictures and come. ओके, तो डाइट ना, इनको हार्ड डाइट नहीं देना, रोटी वोटी नहीं देना 1 महीने तक।
1 महीने तक?
हाँ, सॉफ्ट डाइट, इडली हो सकता है, फिश हो सकता है, सॉफ्ट याद रखो, पनीर बस।
बॉइल्ड है?
हाँ, वेरी गुड, बट नो रोटी, इवन चावल, खिचड़ी इज गुड। दाल इज, चावल इज लिटिल हार्ड, नो, खिचड़ी इज ओके, दाल इज ओके, soups are okay, liquid is okay. See this view, you see how much, this side, look at that, can you see the improvement? Huge. I was waiting for this picture which was not there. कैसा लग रहा है इसमें, देखो फेस, मतलब इतना इम्प्रूवमेंट हो गया। तो एक साइड से ज़्यादा इम्प्रूवमेंट लगेगा क्योंकि एसिमेट्री था, एक साइड से इम्प्रूवमेंट कम लगेगा, दूसरी साइड से बहुत इम्प्रूवमेंट लगेगा, और फेस करीबन इसके बाद उनको कुछ ज़रूरत नहीं पड़ेगा, बस।
फाइनली इम्प्रूव पूरा कितना टाइम लगेगा, मतलब
नॉर्मल जॉ सर्जरी को मैडम 1 महीना लगता है मिनिमम, इनको आप 3 महीने पकड़ो, 3-4 मंथ्स लगेगा। वैसे ना इनको स्वेलिंग कम है, किसी किसी को ज़्यादा स्वेलिंग हो जाता है, इनको स्वेलिंग कम ही है।
ट्रैवल कर सकते हैं?
हाँ, क्यों नहीं?
ऑफिस मतलब पब्लिक ट्रांसपोर्ट,
या कर सकती है।
The aligners that I was having.
Start wearing them again after about a week or so.
Okay.
for the upper side.
Upper side, you can do all dental, जो भी चाहिए आप कर सकते हैं। What you have to be careful is, since मुंह के अंदर से सर्जरी किया है तो इन्फेक्शन नहीं होना देना, तो for that you have to keep it clean, कलेक्शन नहीं होना है अंदर, this is the main thing, because ऑस्टियोटॉमी काफ़ी बड़ा है, प्लेट्स हैं, तो अगर इन्फेक्शन होता है तो रिस्क है, बस दैट इज़ वाई वी कीप यू फॉर 5-6 डेज, इंजेक्शन, अभी भी एंटीबायोटिक्स, यही है, बट आपको भी समझना है ये, तो डोंट डू थिंग्स दैट कैन जियोपोडाइज दैट। और दूसरी बात, लगना नहीं चाहिए, बच्चों को गोदी में मत बिठाओ, हाथ से लगना नहीं चाहिए, ऐसा लगेगा रिस्क है, देखने में लगता नहीं है कुछ, लेकिन ऐसा देर से भी लगेगा, खून आ जाएगा, फिर वो स्टॉप नहीं होता, फिर प्रॉब्लम है। इसीलिए मैं आपको स्कैन लेके दिखा दूंगा कहाँ पे प्लेट्स हैं, कैसा है, क्या है, आपको स्कैन में भी मालूम पड़ेगा कितना फ़र्क है। गेट अ स्कैन डन CBCT।
अगर कुछ ऐसी प्रॉब्लम लगती है
तो वहाँ पे डॉक्टर को जाके दिखाओ पास, अब क्या करोगे? हाँ, कहीं पे भी
मतलब जो उससे रिलेटेड है आपको कर सकते हैं।
दिखाना ही पड़ेगा आपको फटाक से, अगर खून आएगा तो क्या करोगे फिर? आप पास में हो तो आने के लिए बोलेंगे, आप आ नहीं पाएंगे, है ना?
वेट वगैरह नहीं उठाना है, जाना।
करेक्ट, वेट नहीं उठाना, जिम नहीं जाना 1.5 months 2 months, और ज़्यादा दौड़ना नहीं है, ज़्यादा एक्सरसाइज नहीं करना है, स्विमिंग नहीं करना है, बेंड लाइस हो सकता है, हो सकता है। हाँ, खाना, आई टोल्ड यू ऑलरेडी अबाउट फूड, मेडिसिन,
Yes, 5 days medicines are there.
एनफ, इतना बस है, और कूज है, इस कम।